Since 1998, the recognition of angel charities has been a holiday tradition in South Carolina. Each year, 10 statewide charities are recognized for their good work, and this year, Barrier Island's free medical clinic made the cut. Let's welcome Dr. David Peterseim, the organization's medical director. And first of all, congratulations.
Thank you very much.
There's certain criteria that you have to meet in order to make the top 10.
That's true.
And we'll get to that in just a moment. But why don't you share with our audience a bit more about this clinic and what it set out to do, how long you've been there, and its evolution over the years.
Sure. The clinic's mission is to provide comprehensive care to people that need adult medical care, people that are uninsured in order to raise the level of kind of dignity and health and a sense of wellness in the community. And two doctors founded it in 2006, Doctors Booth and Davis. And since that time, we've grown into what we are now. I've been there about 10 years, 11 years.
Wow. And
the medical director, this is my 5th year. So we're glad to offer primary care and specialty services to individuals that need a medical home. Mm-hmm. And we have a pharmacy that we've just opened as well to provide pharmaceuticals on site in addition to the Well Vista program that gives us access to a lot of medicines as well.
Can you share a bit more about the community? So what you're kind of describing sounds a bit more of a marginalized part of our community on Johns Island. So they don't have necessarily the access or the funds to maintain good health. How many people have you seen come through the clinic over the years? Has it increased? Has it decreased?
Yes. We've given 72,000 exams for free in the 18 years that we've been in existence. Wow. So we're growing every year. We serve the whole Tri-County now. Anyone in the Tri-County can qualify for free care at our clinic. Of
course, you can't provide that care without generous people, having a stake in it themselves.
Yes.
And so you've fundraised over the years.
Yes.
So it really does take quite a bit of money to run this clinic
That's
at
correct.
The level that you're doing so. But you were recognized by the Secretary of State as an angel charity for a very specific reason. And maybe you could share that with our audience as well.
Our funding comes from private sources, donors, fundraisers, and grants. So we don't accept any governmental money, federal or state. And we give away more than 80% of the money that we receive directly to services. And that's the cutoff they use for the Angel Award, is more than 80%. And being in existence for more than 3 years and having a significant presence in South Carolina. So we clearly meet all those criteria, and we're grateful for the recognition of the work of 11 paid staff, 120 volunteers that make a medical home for people that currently would have been using an emergency room for sort of spot welding their care. But with us, they can get primary or specialty care for no charge within our building, 5 days a week, Monday through Friday. And like I said, we're so grateful that we now have a pharmacy as well on site to make a difference for those that don't qualify for Well Vista medication support.
Yeah, what kind of an impact has the pharmacy had?
Well, we gave away almost $3 million of medications last year.
Wow.
And hopefully with the pharmacy on site, that number will grow. But 1,100 people need a lot of medicines. Many of our patients have chronic medical illnesses, hypertension, diabetes. We're not an emergency room. We take care of chronic illnesses, adult illnesses. You have to just be over 18 without insurance and meet our financial criteria of earnings less than 299% of the federal poverty guidelines to qualify for care.
And how much money does it take to run this clinic on an annual basis?
So our annual budget is about $1.5 million next year, and we earn or we receive donations in excess of that, or we get grants and fundraisers, and those are the mechanisms that get our money to allow us to function.
And when you talk about the holistic care, I just want to mention a few other things: dermatology, gynecology, psychiatry, ophthalmology, endocrinology. So the list goes on and on of the services that you actually
Nephrology, nutritional counseling, bilingual services,
That's
all
amazing.
of that.
That's incredible.
We're proud of it.
You certainly should be. So what are we looking ahead now for 2026? What's next for the clinic?
Well, we're trying to bring in more technology to help address the diagnosis of silent illnesses, prevention of cancers through cancer screening, the delivery of more vaccines, especially with a pharmacist on site, and an increasing number of nurse volunteers and other volunteers that can help us give more coordinated care. So it's expanded services, is our main goal, but really broadly, any of the categories could be broadened and made better.
Yeah, and you do have an event coming up. So
We do.
It's an annual fashion show.
Yes.
And that's how you raise the money. That's one of the ways.
It is.
That's
We have a fashion. It's called Fashion for a Cause, and it's going to be in the hallway of the Kiowa Club at the River Course.
Oh yes, the
on
River Course
3rd
Ballroom.
3rd of December.
Okay, very good. All right, so make sure you go out there, do give. You can always donate at any time of the year. And for people who want more information on how to donate smartly, you just need to download the Give Smart SC app. I've downloaded it. It's really interesting because it gives all those bits of criteria and information that you need to make the right choice as to where you want to put your dollars. Doctor, I want to thank you so much for joining us today.
It's a pleasure. Thank you for the opportunity.
Thank you for the work that you do. We'll be back after this.